Chapter 17, Using an Integrated Approach. An integrated curriculum bringing together different disciplines offers major advantages. A move to an integrated curriculum. The most significant change that has taken place globally in medical education since the 1970s has been the move from curricula that focused on individual subjects or disciplines to a program where the teaching and learning is integrated. In a traditional discipline-based curriculum, subjects were taught in separate courses, each with its own program of lectures and its own assessment. Students learned about the structure of the heart in the anatomy course, the cardiac drugs in the pharmacology course, and the abnormalities of the heart in the pathology course. The disadvantages were highlighted by Pointer. To take an industrial analogy, it is rather as if a great variety of machine tools were assembled from a number of different car factories and linked together in the belief that the ultimate product would be a motor car of some kind, although nobody was at all sure what it would look like or how it would perform. Figure 17.1, a comparison between how subjects are covered in a discipline-based and integrated curriculum relating to the cardiovascular system. Discipline-based: medicine, pathology, anatomy, surgery, microbiology, physiology, obstetrics, pharmacology, biochemistry. Integrated: CBS, surgery, anatomy, physiology, pathology, radiology, medicine, preventative medicine. A strong departmental structure in a medical school has made integration of the curriculum more difficult. The need for integration, however, has now been widely accepted by medical schools and accrediting bodies. In the Carnegie Foundation Review of Medical Education in the United States, the importance of integration in the curriculum was featured. With an integrated approach, the different subjects are brought together, most typically around a body system such as the cardiovascular system. Integration has been described as the deliberate unification of separate areas of knowledge. The term horizontal integration is used to describe the bringing together of subjects in the same phase of the curriculum. Vertical integration is applied to the integration of subjects normally taught in different phases of the curriculum. Traditionally, the early years of the medical course were devoted to the study of the basic medical sciences. More recently, we have seen, as described in Chapter 12, the introduction of clinical learning opportunities into the earlier years with the basic sciences related to them. More attention does need to be paid to the integration of the basic sciences with clinical medicine in the later years of the curriculum. Advantages of integration: having emerged from the shadows as an alternative approach to curriculum development, integration has become the standard approach in many medical schools worldwide and is required by accrediting bodies. There are a number of reasons for this. Integrated teaching reflects the practice of medicine. An integrated approach, more than a discipline-based approach, encourages the student to take a holistic view of the patient and his or her problems. In a final examination in a medical school that had a discipline-based curriculum, we observed that a student, when asked to take a history from a woman with abdominal pain, inquired whether he should take a medical, surgical, or gynecological history. He had clearly failed to integrate what he had learned in the different clinical attachments. Integration motivates the students. Most students are not interested in becoming anatomists or physiologists, and the relevance of the basic sciences to the practice of medicine may not be appreciated by them. The traditional curriculum, sadly, was often associated in the early years with a decrease in the students' enthusiasm and interest in medicine. Integration by relating theory to practice makes learning more effective. In a classic experiment, divers learned from a text underwater and on the surface. When tested subsequently on the surface, they performed better on the text learned on the surface. When tested underwater, they performed better on the text they had learned underwater. This has been replicated in many other studies. The ability to retrieve an item from memory depends on the similarity between the condition in which it was learned and the context in which it is to be retrieved and applied. What matters is how students can use their basic science knowledge when managing patients rather than in an examination. It is also recognized that knowledge learned in isolation and not applied is easily forgotten, so-called inert knowledge. An integrated curriculum can help to avoid unnecessary reduplication. An integrated curriculum highlights what is important for the student to know and can be seen as a response to the problem of information overload. The integrated curriculum may be more cost effective. Greater efficiency can be achieved by sharing teaching and learning resources, such as the facilities in a clinical skills laboratory. An integrated approach promotes collaboration and communication between staff. Staff need to discuss how each subject can contribute to the learning outcomes. Staff who collaborate in their teaching may go on to collaborate in their research activities. Focus for integration. An integrated curriculum may have one or more themes. The body systems. This is the most commonly adopted approach in the early years of the medical course. Students study, for example, a 6-week course on the cardiovascular system, a 5-week course on the respiratory system, etc. The life cycle. A focus for the integration may be the life cycle, including the newborn, the child, the adolescent, the adult, the elderly, and the dying. This may be used in conjunction with a system-based approach. Clinical presentations or a set of descriptions of the tasks facing a doctor. Task-based learning as described in Chapter 16 and in Appendix 3 is a useful approach to integration, particularly in the later years of the course. The integration continuum. Discussions about integration have been polarized, with some teachers arguing in favor and others against integrated teaching. In the SPICES model for educational strategies, integration is presented as a continuum with full integration at one end and discipline-based teaching at the other. A position between the two extremes may be adopted as described on the integration ladder. This has been found to be a useful tool to explore integration in a curriculum and to identify the most appropriate level to suit a particular curriculum. Figure 17 points to the integration ladder. Less emphasis on disciplines. Greater communication between teachers. Sharing greater central planning. Isolation, awareness, harmonization, nesting, temporal coordination, sharing, correlation, complementary, multidisciplinary, interdisciplinary, transdisciplinary. Step 1. Isolation. Departments or subject specialists, represented by squares, organize their teaching in isolation with no consideration of other subjects or disciplines. Step 2. Awareness. The teaching is subject-based as in Step 1, but some mechanisms are in place whereby a teacher in one subject is made aware of what is covered in other subjects in the curriculum. Step 3. Harmonization. In harmonization, teachers responsible for different courses consult with each other and communicate about their course. Step 4. Nesting. In this integrated approach, the teacher includes within a subject-based course knowledge and skills relating to other subjects. Step 5. Temporal coordination. The timetable is adjusted so that related topics within subjects are scheduled at the same time, with similar topics being taught on the same day or week. Step 6. Sharing. Some teaching is shared between two departments or disciplines implementing the teaching program. Step 7. Correlation. In addition to the subject-based teaching, an integrated teaching session is introduced that brings together areas of common interest in each of the subjects. Step 8. Complementary. There is both subject-based and integrated teaching, but with integrated sessions representing a major feature of the curriculum. Step 9. Multidisciplinary. A number of subjects are brought together in a single course with an integrated theme, but with the subjects clearly identified. Step 10. Interdisciplinary. Subjects lose their identity in a new integrated program. Step 11. Transdisciplinary. The integration is built around the field of knowledge as exemplified in the real world rather than a theme or topic selected for the purpose.